Welcome to Counterpoint. I'm Tanya Granick-Allen. You'd have to be living under a rock to know that Canadian healthcare is in a crisis in many provinces. Many of us have seen or perhaps even experienced long waits for MRIs and CTs, or even a lengthy delay to see a specialist. Perhaps most jarring is the long emergency room wait time, if the emergency room is even open that day. It isn't unusual, after all, to see an ER closed, be it in the rural counties or even in a large metropolis like Toronto, for example, and usually due to staffing shortages. And look, we understand. COVID ran roughshod over the entire system. Staff is exhausted. But as we exit COVID and try to put all of that behind us, is the system moving forward with us? And is the vaccine mandate for healthcare workers only exacerbating an already tenuous situation? Are more Canadians dying on waitlists than before? So what does healthcare look like in Canada? There is so much to discuss around this topic, and joining me now to add his perspective is Colin Craig, president of secondstreet.org, a public policy think tank, and Dr. Shawn Whatley, a Macdonald Laurier Institute Munk Fellow, author, and past president of the Ontario Medical Association. Thank you, gentlemen, both for joining me. Again, very important issue, one that we have to unpack for our viewers because, we want good healthcare when that time, hopefully not soon, when that time comes. We want to be able to rely on what was previously known as a very good, robust healthcare system. So we'll start with you, Dr. Shawn Whatley. You're a doctor, a medical doctor. Give me the lay of the land. What does the Canadian healthcare experience look like these days?
Well, for far too many people, especially our most vulnerable patients, when they get to the point where they need some care, they end up waiting in a packed out waiting room, crowded, people, vomiting or with fevers. And then when they actually need to get admitted into a hospital, they'll spend over 30 hours at the 90th percentile, which is a fancy way of saying the longest waits to get a bed up inside the hospital. For our sickest people, they're lying in stretchers in hallways for over a day and a half. And it's just really unconscionable. So there's two kinds of Medicare. There's the Medicare that we have in our dreams that will be there when we're sick enough to need it. And then the Medicare of reality that far too many of our most vulnerable patients are experiencing.
But hallway healthcare, to use an expression, or seeing patients in stretchers and emerge, I recall this being an issue, at least a decade ago. It's not a new phenomenon, but closing of ERs seem to be a new phenomenon. What's going on there?
Well, we had closing of ERs in the late 1990s as well, and it's unusual to see it again coming back today. But I'll throw a few statistics at you just to give the audience a bit of a sense. So in 1990, and I apologize for using Ontario data, but we had 33,400 beds in 1990, or 3.2 per 1,000 population, and we spent about 8.3% of our GDP. So 33,000 beds, 1990. In 2017, our population had grown by 36%, but our number of hospital beds had dropped to 18,577, or only 1.3 per thousand. And yet we were spending 11.3% of our GDP. So in healthcare, we've tried to use this more with less approach. How far can we stretch the money to care for as many people as possible? And actually what we've done is we've provided less care for more money. It's eating up more of our GDP. So that's the background story. People working really, really hard, doing the best they can, but we're just trying to do more with less, and we're actually doing less care for more money.
Okay, so those stats you shared with me are shocking, which you shared with us all. So if I understand it, we have almost half as many beds as we have 30 years ago in Ontario?
Correct. Now, in fairness, people will jump out and say, well, listen, we're doing some outpatient procedures and we're doing some day surgery and not as many people need beds. So you have to balance it a wee bit. But when you look at the number of beds we have compared to the rest of the world, we're down at around the rate of Mexico or some other countries that maybe we think we're doing better than, at least from a financial perspective. So I think we've cut and cut and cut. And finally, even before the pandemic, the public was coming to realize that maybe those cuts have gone so far that our dream of Medicare when we actually need it is not going to be a reality when we actually get to the emergency department.
And I know during COVID, obviously it highlighted a lot of concerns with one component of healthcare, which is the long-term care. When those either in a palliative condition or just need long-term care and are in a facility, some of the holes or weaknesses within that system. And we will never forget those images of the Army going into Quebec and Ontario trying to straighten things out. We're going to continue this discussion, this very important one, when we return in just a few moments.